So with that, we would like to invite Dr. Ritu Salani to come and moderate our session where we have the two presenters. Dr. Salani is a professor in the Division of GYN Oncology at The Ohio State University. And I will hand it over to the moderator.
Well, thank you for the introduction. I'm actually at UCLA now, so
Oh my God. Okay, I'm sorry.
No, it's okay. It happened during COVID. So
I knew that. And you know, when you talk live, you get a little nervous. So you like look at your notes and yeah, so sorry.
No worries. The last time I was actually in Alaska with this conference, my first time I was at Ohio State, and this is now my third time participating. And it's just such a fantastic conference. And I'm so excited to be a part of this. And what a great session. This is such a novel talk, and I learned so much both from the patient perspective and from the physician perspective, because I'm not very active on social media and I'm inspired to be. And I actually have some great ideas, and I'd love to pick both your brains about it. But first, there are some questions in the question and answer session. So I want to just pose these, and we'll just make it open forum. I'll give my 2 cents too, if that's okay. But Dr. Hahn and Ms. Holdren, I love your input. The first question is from Lori, and it says, are there any institutions that are monitoring or getting a lot of patient concerns or themes to inform their practice? So basically, are there any well-known institutions that regularly watch these concerns and directly respond as in near real time as possible?
Should I say something?
Please go ahead, start. Yes.
No, I think there's movement toward this. I don't know of any institutions that are doing this perfectly right now, but I think, I mean, my biggest hope and my organization's biggest hope lies in the learning health networks that are becoming increasingly popular, where, you know, there's a whole network of institutions and they might be connecting around, let's say, pancreatic cancer or something. And some of these learning health networks have patient advocacy organizations as a node. What does not seem to exist yet is sort of a patient support community at the center of the node, which is sort of our ideal, where there's information going both directions, so that the patient community, because, you know, as someone who's been on these communities, I was diagnosed in 2013, and so it's been a very long time of being on these communities, and I'm not on them as much as I used to be, but there's a lot of really interesting information in there. And I mean, you know, natural language processing is not at the point where I mean, even if we could get consent and everyone thought that was a great idea and it was clear what the data governance structure was going to be when looking at the content of these groups, like this BRCA group that I'm on is huge. This incredibly large longitudinal data set on BRCA. I know there's a lot of information in there that could impact discovery, and yet figuring out how to make that happen is very challenging. But I think that the possibilities within a learning health network, where they're already built so that there's lots of feedback going back and forth. I mean, obviously between institutions that are working in pancreatic cancer or triple negative breast cancer, whatever it is, but also increasingly including advocacy organizations, peer support communities that are very large. And I think the advantage of that is that you know, is multifold. I mean, I think there are huge things that can happen in terms of driving research. I also think there are huge things that can happen if, for example, you know, institutions, you know, if there's a large network and institutions are able to have sort of on-call fellows or something that spend a certain amount of time where they can be tagged. There are some groups I'm on that actually do have oncologists, genetic counselors, others that get tagged by the moderator. So somebody, you know, there's some thread is happening and somebody will, you know, multiple of them will get tagged, and usually someone responds eventually. But I've often thought that if I mean, I realize healthcare providers are completely overworked. So in the current configuration, it's hard to imagine how this would happen. But knowing how many people are getting most of their information on these groups, I think it's very scary to think about that. If there's not more assurance that the information that they're getting is right. And again, I mean, it varies so much from group to group. I'm sure every patient on here has experience of this. And so, yeah, so I think huge hope lies in learning health networks with patient communities as central nodes. They're part of the governance, and they also have, you know, information moving bidirectionally into the groups and out of them. I don't know if that answered the question.
Yeah, I think it does, but I think it brings up like 10,000 more questions. Dr. Hung, do you have any input on this?
Yeah, that would be so hard. So I'm part of a lot of physician groups. I don't have any involvement in groups that include actually patients. So that's an interesting perspective that on your talk as well. And I think that that's a job in itself. I think any specialty having one just answering all the questions. For now, I think the best resource is having your oncologist answer those questions in a non-social media way, but that's probably something that we all probably do day in, day out, answer questions that patients bring from their own experiences, family members, or social media. But that's a tough one. I'm not sure.
Oh no, sorry.
Go ahead.
And that is that one of the models that we've talked a lot about with the BRC exchange, because they're very interested also in this idea of they're particularly interested in hereditary cancers. They're like, how do you increase genetic literacy? How do you get this information to patient populations? And we're like, well, the patients are on Facebook or on these other social media sites. And so that's where we need to go. And one of the models that I think holds the most promise is, I mean, if you look at community health workers in real life, in real situations, so much research shows that to be an incredibly effective way of getting certain kinds of information to patients. And I think if we could have online community health workers, I mean, maybe the online community health workers are the ones who have some access to the oncologist or to oncology nurses or something like that. And so you basically have a train the trainer situation. And then you have the community health workers placed in these big online communities, answering questions, taking questions that they can answer back to people who actually can answer them, and ensuring that the information that's being exchanged is evidence-based. Okay, sorry, I'll be quiet.
No, I actually think that's perfect. That's exactly what I was thinking, is that's probably the best. I don't know how to make that happen, but I will say, I'm not aware of any institutions that have like a platform for this. And I agree with Dr. Hong that this is probably like an individual provider to patient-based exchange. But, I sit on a lot of clinical trial development panels. And one of the things that we feel strongly about is having patients, patient advocates who are usually self-selected or nominated by their by groups, sit on those trial development committees and help inform the way trials are designed that's attractive to patients, safe for patients, and considering things that we as researchers or providers may think, oh, this is the best thing, but then we're not thinking about how many days off it is or how impractical it is for some logistic or another. And I think that's a really smart way to, start designing this or having that patient input. It'd be great to have, many patients in there. It's not always practical. And I'm wondering if there could be a similar design for clinical practice. And Dr. Hong, Dr. Hardesty, Dr. Hope are probably, involved in some of these third-party education companies where that's their focus. We're educating providers on new updates in medicine, and maybe there could be a patient platform too, where there's kind of some, providers nationally, because I think, it is a community, right? And one provider may have a different perspective. It doesn't mean that one's right, one's wrong. There's sometimes different perspectives, just like there's different patient experiences. And so I think consolidating or, having a forum where you can have multiple input, where it's easy. And now with the virtual platform, I think it's very doable even nationally. So I think that's a great point. But I do think, if I may, I'm going to kind of interject my own question. May I call you Jill? Okay, Jill, you made a great point about how when research is conducted, we are using patients. That is the lifeblood of our research trials, but we're not communicating the results to them. And we have patients who sit and design these. And I think we need to actually do ourselves the important service of making sure those patients are able to reiterate those results, because even the patients who help design those trials may not even be aware of where they are, and it does take years. So it's not like, oh, the trial's done, within a year. It might be 5 years later. But I do think we owe it to either survivorship platforms, cancer platforms, or just patient advocacy groups to help inform those results in a way that's interpretable, whether it's negative or not, because those studies would never be done without those patients. And congratulations on being a 10-year survivor. That's amazing.
Thank you. And yeah, I think that's exactly right. I think even when they're negative, it's interesting because actually a project that Joni was peripherally involved with, that another series of interviews, but there was a series of interviews we did at the Alaska Native Tribal Health Consortium and South Central Foundation in Anchorage. And we were talking to the director of research there, who basically through this conversation was, realizing the importance of with every study, every time we've asked a bunch of people to come and do whatever, there should be, you know, maybe every 6 months, a little infographic or something that goes, even if there's nothing to say, but basically to say, thank you so much for, you know, providing that sample. We don't have any results yet, but I think that really builds trust among patient communities, because you don't feel so separate and left out from wherever things are going from the moment that you provide whatever you provide for the study.
Yeah, that's definitely a message I'm going to take back to some of the groups I work with, because I think that really resonates with me. There's another question by Dr. Alans, who says, how do we best address misinformation that patient receive from social media? And this is something that I'm sure Dr. Hahn can weigh in, and Dr. Hardesty and Dr. Hope as well. And Jill, I'd love to hear your perspective. But, you know, I often have patients saying, well, I was told, I read that you can have a pill for this, you know, and it's just, it gets, you know, it takes a lot of time to kind of correct that misinformation. So I'd love to hear other people's perspectives on things that you can do to address misinformation that's not too time consuming, or you don't feel like it's becoming like an argument or like a, you know, disagreement, I guess, for lack of a better term. Dr. Hong, I'll start with you if you don't mind.
Yeah, there's so many misinformation out there, and it's hard to know. And there's also like a lot of physicians who are like social media influencers, and they have their ideas and may not be the same as what you would recommend. But I also, when I address these things, I try to address it in a way where just that nobody has a patient information but you, and those are confidential, and obviously those information out there are for somebody else. And I have a lot of good nurse educators that can also address and print out information for the patients and resources, whether that's like, you know, SGO resource for cancer or the chemotherapy or whatnot. And that tries to help kind of make everything more formalized and seems legitimate, but it's definitely hard. And I struggle with it every day as well. And I think, I'm not sure what the patients, when they bring the information, what is role, sometimes it could feel like questioning your, maybe it's like a second opinion or a questioning type of situation versus, or they just genuinely trust you and want to know what the real answer is. So I think those are some of the different ways to approach it.
Yeah, and I think one thing I do the same thing is that I try to save paper. So I usually try to use the MyChart portal as much as I can instead of printing out resources. But I do think it's important, and I try to find resources that I can, you know, that I feel are evidence-based, provided by, you know, foundations or societies that are dedicated to these cancer treatments, and send those to patients. And I think that's helpful, because I think it helps sometimes, you know, allay concerns, but at the same time, it can be overwhelming for patients too. And I want to try to, you know, minimize how much they have to read. I feel like that's kind of my job, but at the same time, time is not always there.
Right.
Jill, what's your experience with misinformation? How do you help kind of, if you have a platform and a patient states, you know, one of your colleagues you're in your community states something that you're like, oh, that doesn't seem right.
Yeah, I mean, it's interesting. I think obviously it's a huge problem. I don't see it going away with social media entirely, but it's one of the reasons why I think these ideas of community health workers, these ideas of fortifying or establishing in the first place, and then fortifying and creating certain kinds of relationships between healthcare institutions. And I mean, the reality is that okay, there's social media in general, and there's, you know, there's completely publicly available social media. We can all see what's going on there. And then there are these private groups. And the reality is that people are going to go there, and they're going to get a lot of information from there. And so given that, like, that's part of the reality, it is a part of the healthcare system. It is an unrecognized part of the healthcare system, but it is an important part of how many people are navigating cancer, for example. And so given that, how can we like mitigate to the biggest extent possible the misinformation, disinformation problem? And that's where I go back to thinking about having those relations. I don't know exactly what it would look like. I think about learning health networks, think about community health workers, you know, train the trainers programs. But I do think about how do we bring this informal part of the healthcare system into the healthcare system in some way more, so that it can be I don't want to say controlled, I mean, but so that there can be some quality control there. I mean, many groups that I've been in, the groups that I've stuck in are ones where people's misinformation get corrected very quickly by the moderators. And so somebody might start a thread, and then somebody's like, well, no, that's not how it works. I mean, you know, this kind of thing. There's certainly many groups where that doesn't happen, and I'm sure ones where it's perpetuated indefinitely, and then you guys, you know, get to deal with that. But I don't know what. So, I mean, I think the the person who asked the question was maybe talking about what do you guys do as doctors when you're confronted with it? But I think we have to go before that and say, okay, where are people getting this misinformation, and can we target that? And that requires investment, obviously, and nobody wants to spend money or really sort of think about, I think, building new systems for understandable reasons. I mean, but yeah, that's what I think.
Well,
That
Dr.
seems
Hung,
like almost an impossible feat. I think there's so much. I'm sorry. I think I interrupted you.
no, please go ahead.
Yeah.
Go ahead.
That seems like an impossible feat. But like when you were talking, I kind of had a thought of like if professional societies like our Society of Gynecological Oncology could have a section on patient groups and have where like patients who have been through cancer can join that are more literate in healthcare and things and be out there being the moderators or like some kind of bridge, or they could have this subset of society where they're members as well as patients, but they're not like in that physician role, but they have like their own society of gynecologic oncology patient version where they could all get all the information and thread it down from our societies.
Yeah,
I'm not sure how that would work.
Yeah, there almost has to be an interplay, right? And
I'm not sure how that would work, but
yeah, I congratulate you on creating the Women in Oncology group. I think that's pretty incredible. And I have to admit, I'm not on Facebook, so I'm not part of it, but I do know a lot of people who are. And I think that community kind of creates that, because you mentioned that you sometimes ask questions about patient care, right? And I think that's important because you're asking questions about probably rare situations or situations that don't have a lot of evidence on it. And then you have kind of a consensus. So it's not just a one-off. And if somebody has an opinion or some insight or experience with it, they can share that, and then other people can chime in. And so you get a little bit more experience than just, your N of one. And so I think that helps. And I think for patients too, and it doesn't mean that, I always think misinformation is always a little challenging to use when it's an experience, right? So a patient experience isn't misinformation, but it may not be applicable to the general population. And I think, how do we handle that, right? And so I think that those are some times that we have to kind of step back and just say, okay, how do we redirect this? And Dr. Hung, your comment about, maybe having a platform on a society, which maybe there's several moderators who are nurse practitioners, PAs, physicians, nurses, who have that clinical insight, can help maybe address some of those comments or questions. But I agree, it's a resource intensive a project. And I think, it's hard to give more time. So there's got to be some investment, and maybe the societies are the right place to start.
Can I just say one more, is there time for me to say something?
Yes.
So there's a really interesting woman that I interviewed during that project, a few years ago, who she has several groups for inflammatory breast cancer, and she ended up being a patient at MD Anderson. She was like in the only place where there were, at that time when she was diagnosed, that there was a program on inflammatory breast cancer. She had been misdiagnosed 5 times as one of those nightmare scenarios because it's very rare, right? And what has happened is that program at MD Anderson refers all of their patients to her Facebook groups, which is really weird, kind of. I mean, it's like, on the one hand, it's wonderful because a good group has the potential to fill in all sorts of gaps that the formal healthcare system simply can't fill. It doesn't have the resources to do that. But at the same time, it's also kind of weird. I mean, if you think about it, she's a patient, she's not a doctor. I mean, she knows a lot. She's very, very, very literate in inflammatory breast cancer. But I guess my point is, I think, and I've been in other groups where there are lots of physicians who refer to those groups because they know they're evidence-based and so on, and they know they have the potential to play an important role. So it seems like there should be some way to do some train the trainer stuff. I don't know, get some big grants to do that. We keep talking about it with BRC Exchange, and just see what happens. I mean, at least do sort of a pilot project. We keep talking about doing in the hereditary cancer community. We have these groups of 10,000 people. We do some train the trainers of community health workers and see what happens. I don't know.
No, I think that's I think that's the right direction. I think that's really amazing that you guys have already gotten that far. There's a comment that we just have a couple minutes left, right? Is that correct?
Yeah, you have 10 minutes.
Okay. There's a comment that I just want to share because I think it's it's a nice summary of what we've been going through, but it just says, I think of our experience with COVID, that healthcare providers were not impacting the conversation, but rather reacting. So in GYN-ONC, creation of approved or peer-reviewed patient resources without picking up the phone, everybody wants answers now. And I think that that's right, is that, we do have to figure out ways to, get this information disseminated in a practical fashion. And I do think there is some reaction, but I think it's right that we have to process it and kind of have that before it goes out there and have, kind of a better consensus or better understanding of what the situation is. So, and I agree, this is a great topic. I could talk about this all day, and I'm more from a learner standpoint, not from an educator standpoint by any means.
Well, I unmuted because I just wanted to say that, I'm a huge fan of women of GYN oncology. I'm sure Dr. Hong has figured that out. Especially, no, I mean, honestly, especially being in Alaska. So we're in Alaska. There's two of us. Sometimes we have a different interpretation of the literature. And, sometimes I tell people, there are clinical situations where you might go see 10 GYN oncologists and get 4 different opinions. And most of us are familiar with which ones those are. And, when I have a patient that's in that kind of situation, sometimes it's handy for me to put a question to the group. You can make a poll. You don't have to say, any PHI. You can say, what would you do if you had a patient with this kind of cancer with this and this? And then you put like 5 options. And I go back to the patient and go, look I just asked 300 GYN oncologists. Half of them said this, 25% of them said that. I mean, literally, because how I even answer those questions from one period of time to a year later, that answer might change based on new literature. Look at the PARP stuff. It's like a super highway. And literally with the PARP stuff, you can put something on there and like Katie Moore will respond. She's like,
Right.
the first author on all those papers. I mean, she spends all day long like looking at that data. So, I feel much more confident going back to my patients going, well, Dr. Moore would do this and I would do whatever she does because she's more informed on the topic and has all the looks under the hood and knows all the data. So, I mean, I can't say enough about the platform and how great it's been for patient care. And as you said, for community, because quite frankly, I also managed to get myself at a Packers game with my husband. That was a huge bucket list item of him through somebody that I met on that platform that I didn't know before. So, it's just great all the way around. And I'm a giant fan.
Thank you.
I don't see any other questions in the chat right now or in the Q&A box, but are there any other tidbits that you'd like to share with us? Or even as physicians, how can we better engage with our patients on social media? So Dr. Hong, you mentioned TikTok, you mentioned Instagram, and you mentioned some of these other platforms, and how do we, I don't want to say like self-promotion, but how do we get patients to kind of engage with us instead of Google, the dark web, right?
I know that's really difficult because I kind of have a fear, there's a lot of like physician influencers or like people on educating YouTube and things. And I kind of have second thoughts of doing those things because there's a lot of hate as well as love from the community. And it's just being famous in itself, I think it's really hard for those people and can catch a lot of people hate from all over. But it's really hard because I don't engage in a lot of like physician patient communities, but maybe there should be, I don't know. I'm in multiple different groups for communities that I have added throughout the years that may not be as engaged in, but that's a tough one. I don't really interact with patients over social media. Have a strict rule of that, so.
Have you guys, I mean, it's interesting what has happened on Twitter during the COVID pandemic. There were a number of physicians that, I mean, there were whole, med Twitter back and forth on like when people first started seeing pulmonary embolisms in COVID. And it was all happening on Twitter. Like that's where the physicians were exchanging this kind of like, have you seen any pulmonary embolisms at your ER department? And it was really interesting. But there's also, I don't know if you guys are familiar with like the GYN social media chat on Twitter, and then the BCSM, the breast cancer social media chat, which are huge, both of them. And they have like weekly chats where they have physicians and patients come, people follow the hashtag, right? And then they have topics that they go through. I don't know if any of you are familiar with that, but they have been very popular, and lots of patients engage on that, and lots of physicians.
I see.
So pretty wonderful. Do you know about those?
I knew, but I'm not in Twitter actually. So
okay.
I don't.
Yeah, I mean, Twitter now maybe is not the place anybody wants to be, but those have been really, it seemed like really great, but then they're getting one little segment of the population, and then you've got everybody
They
else.
had a Facebook version of that too. And actually I got a lot of my understanding of kind of what was going on with COVID by following the
Yeah,
Facebook.
they had a live COVID group, I think, right? At
Yeah.
Dr. Porter
And you could see, like, you could literally see, like, oh, okay, it's starting to go nuts in this city or that
Yeah.
city. I mean, you literally got, you know, I mean, it takes months to get things published in medical journals, even when you're kind of jamming it through with, you know, emergency communications for pandemics and so forth. It's still not that quick of a process. So
Right.
there's definitely that platform on multiple platforms, including Facebook.
Yeah, it's probably not the right resource, but we all have, most of us are using a similar medical record system, and it would be almost, I was thinking about the patient privacy and the, tracking of patients, and it might almost be nice if there were a way through this medical record system where it's just like an email or like a social portal through those that you're protected and these companies can't target you. But it's such an issue, and I know when patients go on there and they as physicians, we don't have really HPI that for us, what we do, just look us up. But for patients, as soon as you become a member, your name is on there, you are exposed, right? And so I think that's a really sensitive thing. So I think it's really a testament to people who have shared their information or even participate in these groups, or loved ones who do this as well, just to learn more. But I do think that we have to be sensitive about that. And I do hope that, some of these companies that are targeting or using that information for bad purposes, the hacker thing is really scary. And I think these are things that we have to always be mindful of.
Can I say one last tiny thing on that note? That when we found this vulnerability in Facebook, we reported to Facebook, they denied it, but then they ultimately took it away. There were all these Chrome extensions where within 30 seconds, you could download every name in a 10,000 person private group, right? And so obviously for people with ovarian cancer or, clear cell carcinoma, whatever it is, you could download and you'd have a list. And obviously, like, if you're part of that group, you have that thing. There was even one for gay men in Iran. Can you imagine? I mean, things like this, and there were multiple Chrome extensions where in seconds you could get, and then they closed that loophole so that you can only see the names now if you're in the group. But still, I mean, if you get in the group, then you can see the names. But anyway,
yeah, no, that is very, very worrisome. Yeah. The other thing I want to ask is, I mentioned I participate in clinical trial development. I know many others on this call and in this conference session have as well. And I always think that one of the ways, sometimes patients just don't know about clinical trials, or there's misconceptions about clinical trials. And I think social media might be another good platform for educating. And I think, when we have patient advocates on the panels developing the trials, they sometimes reach out in their own platforms to say, hey, this trial is being developed. These are things that we think are great about these. And I always think that's a good tool. I don't know, from a patient perspective, is that something that's attractive, or is that something that you're like, it's a little bit of a turnoff? Or
no, I think that absolutely is attractive. I think it depends on the group. Some groups are going to be wary. If it's coming from a patient within the group, I mean, a member of the group that way, people, I think, tend to feel very differently, especially if it's from a moderator, a trusted. Many of these groups have very trusted moderators, administrators. And then I think if they say, this is a trusted, clinical trial that we've sort of vetted, we know these people are for real, whatever, I think it tends to be well received. I do want to say that in various of the interviews and focus groups we've done in the past few years for a variety of different projects, many patients talk about how they were never offered a clinical trial. It really seems to be an issue. And even people in sort of big urban centers.
Yeah.
I mean, and realizing obviously that there are, qualifications you have to meet and so on, but the idea that people weren't even told to consider a clinical trial or look at what might be out there.
Right. And I think it might be nice to have and maybe this is, I'm just kind of thinking out loud, is if we had like a really clean sheet that said, this is, what the problem is. This is why this trial is being designed this way, like a little bit of background information that's very patient friendly. This is who's eligible for this trial. And these are where this, some sites where it may be open, or just something really clean. And this is the purpose, and maybe a timeline just because of that lack of, kind of follow up. I think that'd be really cool. Right. And I think it just might help. I don't think it would hurt.
That would be really cool to have actually the website, where we go on to find clinical trials, but in patient, literacy type language, and so easy.
Dr. Hong, we have a job. You and I are going to connect on this.
Yeah, that sounds amazing, actually.
Yeah, and just I was inspired by what she was saying, but I think this is how ideas get generated. And I think this is awesome.
That's amazing.
And then even better if you target that on social media platforms where there might be a higher representation of underrepresented groups, then that would be another, and Canna and some of these other, networks, that would be an even better way of trying to.
I think
better
that would be
job.
True, but I
amazing.
think you want to partner with advocacy organizations that work in those spaces, like, Black breast cancer groups or whatever it is, so that it's, I think there's, and our organization is really trying to sort of push back against that targeting that's coming from outside the community. So making sure that you're hand in hand with a community organization from that community.
I think you're exactly right. I think we have to have the right stakeholders, and this is something. And Jill, it sounds like you're volunteering as well, so this is awesome. I'm inspired. I think that's exactly right, and I think this is, I always say research cures cancer, right? So this is the first right step. But it's always information, allaying some of those fears, but really having an understanding of why this trial is being done. What was the information that designed this trial, and what is the goal of it? I think we are scheduled till 4:45. I want to be mindful of time. Are we good?
Yeah, I think we're just about ready to wrap it up.
Okay, well, thank you for having me as a discussant. This is amazing talks by both of you guys. So thank you so much.
Well, thank you for inviting me.